Good afternoon, everyone. And today we have Associate Prof. Dr. Muhammad Nazar Azmi Muhammad as the speaker. He is a consultant sports physician, head at Sport Medicine Department in Faculty of Medicine, University Malaya, and he will be speaking on the topic strengthening your knees. And ladies, I hope you all are wearing your exercise clothes as we have mentioned in the poster earlier. So later on, we will be having some movements done with Prof. Nahar. And and yeah, Prof. Nahar, you can take it.
Okay. Thank you, Pavitra, for your kind introduction. Assalamualaikum warahmatullahi wabarakatuh. A very good afternoon to everyone. So, how's everybody? I hope everybody is well and stay safe always. Yeah. I would like to say thank you for the opportunity given by BCWA to give me the opportunity to convey sharing knowledge to everyone in regards strengthening your knees. I'm sure most of you remember last year we had one session where I think it's just general information about activity to get yourself active and move. Yeah. Um, Now we going to be a bit specific on the topic. It's like a short workshop. Miss Ranjit did ask me what topic. She gave me few options, so I think I decided to share about strengthening your knees in regards which I've seen quite a lot in the clinics, and then these are the most common things happen not just among the seniors, yeah, but also among the juniors juga. So of course the problem will be different from a wide range of age, and it may from no trauma or injury to sudden onset, or perhaps because of the wear and tear. Yeah, so that will be due to aging lah. Okay, so I will talk about a little bit. I try as much as possible not to bore everyone. We will do a lot of practical. Besides the exercise later after the session, so in between, I would like everyone to join, yeah, during the demonstration. So if you have any question later after the Q&A, during the Q&A, you can ask me about is it correct or not what you did or something. So you can ask later. But I will demo the movement later in terms of the exercises for the knee, and if you could follow while I'm demonstrate the movement, so it will be very good. This is a part from the exercise that we're going to do after the session. All right, can move next slide, please. Yeah. So okay, this is the content. Can next slide. Yeah. Okay. All right. So now, just to show an overview about the muscles. Yeah, this is basically the muscles that which will contribute to the movement of our knee joint. Okay, and if you could see on your, I hope it's on your right. Yeah, on your right, there's a group of muscles. Yeah, that a group of muscles, what we call quadriceps. If you could see it written with rectus femoris, vastus medialis, vastus lateralis, yeah, those three are what we call quadriceps. This is there are important muscles which the tendon will attach to the kneecap. Later I will show you the kneecap. Yeah, then this is actually important muscle. If you don't strengthen this muscle, one of the important muscles of your thigh muscle, then you will, sometimes people will complain, how come I can feel, I heard clicking sound, you know, click clack, or when climbing upstairs or when getting up from sitting, yeah. So this muscle is actually is one of the important muscles that we need to strengthen. So we need, I will explain on this later on. I just show you the muscles. Then on besides quadricep, that way the behind, yeah, the behind thigh muscle, what we call hamstring, where you can see there bicep femoris, and then a semi membranosus, yeah, and semi tendinosus. Those are hamstring muscles, yeah, what we call hamstring. And then below a little bit, you can see gastrocnemius. That will be part of the calf muscle. You can see that the intersection between the tendon. So what? Okay, muscle. All we define muscles is all the red color. Yeah, that muscles. The whitish color, that continuation from the muscles, we call tendon. Okay, so the tendon that will give an extra extension from the muscle and attach to another bone. So tendon is a connector between a muscle to bone. Okay, next slide. Okay, so this is from front view of your knee. Okay, so this is basically your knee. The okay, femur is your thigh bone. Okay, patella is the kneecap. Okay, articular cartilage is the cartilage lah. Cartilage that covers your thigh bone, which it will protect, and additional like a shock absorber to when you have impact loading. Apart from the meniscus, in between, if you can see that there's one below articular cartilage, there's a like a thick layer that is actually the meniscus, yeah, and beneath that is the what we call the tibia bone or shin bone. Okay, next. So this from side there, you can see the thigh bone or femur, and then tibia, okay, the shin bone. Then the patella is the kneecap. Okay, from patella to the tibia, there's a tendon, the white color, yeah. So that is continuation from the quadriceps muscles, quadriceps. So quadricep muscles, quadricep tendon, go pass over to the patella, then it became patella tendon. So these are important structure to for your knee able to flex and to extend. Yeah, bend and straighten your knee. So flex is bending, extend is straighten your knee. Okay. Um, yeah. Next. Okay, so there's another picture of the knee, so similar, but this there's an additional structure. You can see that there's a anterior cruciate ligament. Yeah, so there's a ligament. It's actually a structured connecting. Yeah, holding the your femur and your tibia. Okay. Yeah. Okay. So that is your anterior cruciate ligament, and then you can see that there also lateral collateral ligament. Yeah. So the sides, and then it will connect from the side part of your femur and also your so-called the tibial bone or fibula, yeah. So the lower part of your bone. Okay. Yeah. So that's the articular cartilage. Okay. Thanks. So just to give everyone an overview about the structure. Now this is a slice. Yeah? Slice. When you slice the bone, then you can see there's a cavity. Yeah. the cavity. So the cavity is covered by a capsule. Yeah, it's a fibrous capsule. It's quite thick. Yeah. So and then inside there, there's an what do you call a fluid, synovial fluid. This fluid is actually an important fluid. It's like your diesel, not diesel. What do you call that? A grease. Yeah, yeah, grease for the joint to allow the joint move smoothly. So the grease is actually a product from the cartilage itself. Okay, so your cartilage is actually the factory, yeah, the factory for the fluid. If the factory damage either by injury, okay, accident, trauma, yeah, injuries, or by wear and tear when you get, when you're aging, so it will get thinning. Then that's where the production of the factory it become less. That's when if your muscle is not strong enough, so the loading will become a problem. It will cause impact to the joint, and then the meniscus will become thinning. The cartilage also become thinning, and then that's where when the bones start to touch together, the thigh bone and the femur and the tibia, when it touch together, that will cause pain. So that already grade 4. So we have grades, yeah, like level for what we call osteoarthritis. So this I will explain later. Can go next slide, please. Okay, so this is what do you call that? Cut through, looking at the cartilage itself. So you can see that when there's damage of the cartilage, so it will become like a hole. Yeah. So you just imagine when the factory get burned, then it will damage. So some of the production of the factory is not sufficient to provide supply to the whoever that inilah pembeli lah kan. Okay, so something like that. So make a situation so make easier to understand. Okay, next. So that's why sometimes then you will hear, oh, your knee no grease lah. Okay, something tak ada pelinci like that, yeah. And then you heard that, oh, the one person, that somebody need to get injection to put gel inside. So that is inside, to put inside the cavity, yeah, to give a so-called a supply for the knee can function, yeah, and also to provide nutrition. So when the damage happened to the cartilage, so as I said just now, the factory unable to produce the fluid. So the cartilage says there's no supply of the synovial fluid, where it become lessen, and then when the damage become much worsening, and then the production it become much less and less lah. That's why the space between the bone become narrow, and it compressing each other. Then it become and then when once it's touched together between two bones, then that's where people will start become complain of pain and unable to bend or extend, or even it can becomes crooked, yeah, like X shape or O shape, yeah. If you saw when you see a person walk, then why the what do you call that, the shape of the leg is like O shape or like X shape. So it's because of that. Of course, there's another disease may cause that also, yeah. But if you looking at from let's say from one person, you can saw them walking normal, but at one point of time, let's say after at the age of 60, 65, or 70, you can see the difference, the way that they walk, yeah. Partly because of this, and then also wasting of the muscle, or what we call that, the muscle shrink, because not being sufficiently strengthened and being neglected, yeah. Most of the time we are neglecting strengthening our muscles. that is actually very important. Okay, can we go next, please? This is actually MRI, to show MRI cutting. Yeah. Okay, now what causes knee pain? So just now I've already explained. I show an overview in regards the anatomy, the structure, and what are the what do you call that structure that included in knee. As I mentioned, there's muscles, there's tendon, there's ligament, there's cartilage. Okay, and then there's synovial fluids. Those are the so-called component of the knee. Yeah, so at least everybody gets some idea about that. Okay, now what is actually the causes of knee pain? Okay, next, please. Okay, usually, of course, the inflammation should be around the knee lah, not outside the knee area. So those the red color is actually to tell you that is the locations of when you have knee pain. It can be sometimes when asked patient where's the pain, they can't describe the pain clearly. So we have to examine thoroughly to see sometimes the structure is quite vague or there maybe there's a swelling and redness. So to tell everybody when you are inflamed, there's a what we call the signs of inflammation. So the signs of inflammation are okay, redness. You can see the skin. It's not really red, but I'm sure you can make you can see the difference. The skin color. For example, the knee, the skin color of the knee with the surrounding skin, and then you can feel it's really warm. Even sometimes, like the knee is actually having some kind of fever. Yeah, you can feel the difference. So you have just now redness, yeah, redness, warm, yeah, also pain because of sometimes there's swelling or without swelling also it may cause pain because of inflammation, and you have limited range because of the swelling. Then the movement of the joint, knee joints, very limited. It's either you difficult to bend or even sometimes extend. That's why sometimes when you have pain, you cannot stand properly. So when you cannot stand properly, then you are shifting your load to another part of your body. It can be at the same leg or a different leg, and even it can cause pain or straining to another part of the body, like your body or your ankle or your foot or your heel, because of the disturbance or the alignment is being disturbed because of the pain, and then you cannot stand properly, and even you walk awkwardly. Those are the changes of the biomechanic of your body that may contribute to straining and cause pain later on to other part of the body. And that's why people will say, "Hey, how come my main pain is here, but suddenly it changed to your right knee and then left knee and again change over?" Because once the body knows you have pain on one side, so when you try to be active, it will shift to the one that not having any pain or inflammation at that moment, will support your load, your weight bearing. But then after sometimes when the body is not enough, because the part, the healthy part is supporting double of the effort of your supposedly what the let's say your left knee should support, but then because your right knee having problem, so all the load shifted, so it's become double. So after some time, maybe after 1 week, 2 weeks, 3 weeks, and cause pain, and at the same time your right is actually recovering, but it's not healed properly, because you have to remember when you are not using your other part of the body or the muscle, so the muscle is become weakened. So when it recovers because of no pain, but even though you not gone through so called her rehabilitation period, but because no pain, because when you see the doctor, the doctor say, "Oh, you take this pill, and you when there's no pain, okay, start back your activity." Yes, when you take painkiller, definitely lah, but you didn't solve the problem. Problem is the muscles is already weakened. If you not use your muscle even for a week, the muscle will be deconditioned. The strength will be much less. Then when you start to walk normally, then you shifted back, then the body shifted back to the affected area, the initial affected area, then it will immediately suffering again and cause pain. So then your body will try shifting side, either right to left or left to right, and then some more it will shift it back, then it cause back pain, and so on and so forth. So basically, that's the reason why sometimes people say, oh, how come I've got macam kenapa dia boleh merebak? It's not merebak, it's just because of the shifting of the load that try to transfer and try to avoid pain at the affected area at that point of time. Okay, but because they've shifted to another part of the location, then it causes other location to suffer. Okay, next. Okay, so just now to show the bone, this is the affected, generally affected area lah, as what as mentioned just now. Okay, next. Okay, so these are basically the common the common pain for the knee if by location. You can see that the knee joint and the back of the knee, yeah, inside the knee, where there's inside the knee meaning there's meniscus, yeah, yep, and then there's also where there's below your knee there's some kind of what do you call that, a bulge there, so that's where sometimes may cause pain where there's a tendon from the patella attached to the lower bone, where it's more prominent. You can feel that the a prominent bone, like pinjol macam tu, so that sometimes may cause pain, and usually that's happen to adolescents, yeah, adolescents, active adolescents. That's what we call Osgood-Schlatter disease. And then other the kneecap pain, yeah, is either behind the cartilage of the kneecap. It can be due to injury also, yeah. Of course, wear and tear, that's once you mostly more than 40s, but now osteoarthritis can start much earlier because it depends on how early it been apa tu insult, yeah, because of the injury. So most of the athletes, yeah, when they active at very younger age, like 8, 10, 11 or 12 years old, by the age of 19, 20, their cartilage uh, the damage lah. I've seen quite a number of especially those athletes with jumping movement, a lot of jumping movement like basketball, netball, or any contact which involve knee. Yeah? So when they start early at a very young age, I've given a number of injection for athletes aged between 19 to 25 years old. So you just imagine from that age they have already started have that, and then just imagine if let's say 10 to 15 down the line, they need, if let's say it's worsening, they need to have knee replacement, which is actually not a good way lah kan, if they don't look after themselves very well. That's why even you have injuries, you need to look after yourself very well. Even when at the age of 40, 50, you have knee pain, of course you have to tackle what's the cause of the pain, but at the same time you need to do what you call the exercises that may help to strengthen the muscles, may at least to reduce further deteriorations of the condition. It may not 100%, but at least you may able to perform your activity very well. I've seen quite a number of 60 or 70 years old. They are very active, even though initially they have pain, but provided they have very committed to the prescribed exercise that given either by physio or by us, sport physician. So that will be, or even by rehab physician also. So then if the person comply with the recommended prescribed exercise, then they should be okay. And as damage done, but of course, when you undergo a process of so-called rehabilitation, at least not at least you may able to perform even though not 100%. So if more than 90, 80 to 90% is actually already good for you to be independent and to be active. Okay, next. Okay, this is two main what we call that complaint. Yeah, it's either because of the arthritis, as I mentioned just now. It can be due to degeneration, but it can be due to some kind of um, immune system. Yeah, for example, like systemic lupus erythematosus or rheumatoid arthritis, or because of gout, yeah, gouty arthritis, other than osteoarthritis. Okay, and injury, definitely when you injured, either you accidentally fall, slip, which it can happen quite a lot. I've seen just recently one of our head of department from one department. She was doing her so-called chores at home, washing dishes, and said, I'm sure the floor was really wet, so maybe she's rushing or something, and then she slipped. So when she slipped, she twisted her knee. When I examined her, definitely I told her that that will be a meniscus injury, and then we had MRI done. So yes, confirmed that she had meniscus tear. So yeah, so that's an example of injury, even though you are not active in any physical activity lah. Sama either walking ke ataupun you play games or something like that. Yeah. So those are can be meniscus, it can be your anterior cruciate ligament, or there's the tendon injury, or okay, bursa is actually a cushion in between the tendon and the bone. So when it glides, when your tendon glides, so you need there's a structure like a sponge, yeah, that will protect the what do you call it, the tendon from rubbing the bone. So otherwise, then your bone will easily get the degenerate. Yeah, but if let's say there's some time because of it may get inflammation. Yeah, inflammation due to injury, yes, and secondly because of the repetitive movement, which for example for example you climbing, do some hiking, this previously you have not done quite extensive, very intensively, but suddenly that day you instead of you spend usually 1 hour, you spend for 4 5 hours, and then you have not rested properly. The next day you do something to keep yourself active. Yeah, there's no recovery period. Whatever activity that quite exhaustive the day before, you need to get you do a recovery. You need to get recover. Yeah, at least if you still want to be active, do something lighter. Take it easy to avoid straining that may cause injury. So something like the bursitis, where the because of the rubbing, yeah, and it cause the sponge inflame. All right. Okay. Of course, when you fall, sometimes you can may have the attachment of the where the tendon attached to the bone. It may fracture come out. So it's a fragment. Yeah. Okay. And also when your muscles not strengthened enough at one point, when you can feel that it wobble, and then at time when you have sudden awkward heart movement, it may shifted go out from the groove itself. That's where you may have what you call that dislocation. Similar to shoulder and hip can have dislocation also, that usually due to injury. Yeah. Okay, so these are another so-called to give an idea according to region. So anterior is the front, posterior is the back, lateral is the side, outer part of your knee, and then medial is the inner part of the knee. So those are example of the where type or structures of injury may happen. Yeah. Okay. Next. Okay, so this our osteoarthritis, yeah, the osteoarthritis, they have different grade, yeah, grade 1, 2, 3, 4 is the worst uh, category, yeah, grades. So that's why when the orthopedic surgeon noted this, and then they will recommend total knee replacement to some of the patients lah. Okay, which is actually quite because it's already knocking each other, yeah, the bone already knocking. This is actually not too bad. There's some x-ray showed that really bad, even you cannot see the space at all. Next. This is the one that I mentioned just now. So there's no space at all. So you can see the O shape. This is what you call the O shape. So the medial, meaning the inner, the line, yeah, okay, the knee joint on the inner part close together, yeah, and then you see whitish what you call that color from the x-ray itself, so meaning that it's already like causing like erosion, yeah, will cause sclerosis, yeah, to the bone. So it's that definitely this patient will feel very painful, even maybe cannot walk at all, yeah. So from this point, of course, but of course, not all cases can go for operation. Yeah, even though maybe the patient want to, that's maybe need to be assessed quite thorough by the orthopedic surgeon. Yeah. Okay, next. Because the important thing when you do operation, you need to know the end point, the outcome later on. If the operation, the outcome was bad, why you want to do the operation? You spend thousands, but the results, the outcome is not good. Okay, next. Okay, now the treatment. Next. Okay, just to give an overview, yeah, some of the management. Okay, it can by medication. Either I think the most common things that when you go to doctor, when you have pain, they will give painkiller or non-steroidal anti-inflammatory. Non-steroidal anti-inflammatory is anti-inflammation medication. It's not painkiller, but it can relieve pain because when you control the inflammation, if you remember just now earlier I mentioned the sign of inflammation, yeah, so it will block the pathway of the inflammation that may cause pain, yeah. So yeah, I'm sure some of you might experience with Ponston, Voltron, or nowadays Celebrex, or what do you call that, Acoxia. Those are now like gula-gula for some lately, yeah, because of the pain. All right. So viscose supplement is the injection, the gel injection. Yeah, it's not steroid, but there's also injection with corticosteroid that for acute inflammation. Sometimes patient come with pain, very bad pain, and then there's swelling of the and for example, if the knee, so we inject non-steroidal anti-inflammation. No, it's actually steroidal. It's not non-steroidal. It's steroidal. It's corticosteroid. Yeah, we inject that. That is anti-inflammatory. Yeah, so it will reduce the inflammation, but still, most of the time, it will follow through most of the time, not all the time, yeah, follow through with hyaluronic acid injection or HA or what you call the gel. Okay. Nowadays, there's another what you call supplementation injection like PRP or even stem cell. But of course, this even though studies still conflicting from one to another because there's no so-called standard dosage for PRP or even stem cell is actually very expensive. Yeah, you have not it haven't come down yet. Okay, so the non most of the time other pain is basically to reduce, to relieve. Okay, but the most important thing is we need to yeah, you reduce the pain, but at the same time you need to improve the affected area, because when you have pain you will be deconditioned, meaning you are not using the that part of the body very much. So when you are not using it, the muscle will become weak. So when it become weak, it will become shrink. So it will reduce, so called the muscle mass will become very very thin, and that's where it cannot when let's say you want to walk, get up from sitting or even climbing upstairs, either you cannot at all or you can, but you can feel that the knee kept rubbing to the bone. Okay, so that's where the non-medication, what we call the exercise rehab and physiotherapy involved. Of course, when it comes to worst scenario, when you have to, and then you have to lah, if you have to go to surgery for surgery. Okay, so surgery, it can be, depends on the injury. If let's say meniscus injury, they will repair. If the ligament tear, like the anterior cruciate ligament tear, then it will repair also. But if for the osteoarthritis, if the condition of the cartilage very bad, then need to do knee replacement, then knee replacement lah. Okay, okay, next. Okay, now sometimes at home, yeah, there are things that you can do immediately, not wait or just okay lah. I can stand the pain, or I just take Panadol or something like that. But when there's injury, let's say you knock your knee, your knee knock, either you slip and knock kan, the floor, you slip and slipped, not slip, slipped, and fall down, and then your knee knocks something lah, and then it's cause pain, and you can see swelling. So what immediate action that you can do? Next. Okay, ice, yeah. Uh, what we call the cryo cuff. You can see the tumbler there, that is the cryo cuff. Or just simple ice. Yeah, if you have ice bag, you can put ice in that bag and apply. So why you need to apply ice? Why you cannot apply ointment hot, like Perskindol lah, or what, ointment minyak kuda lah. Sometimes people say, oh, you just apply minyak-minyak lah. Um, and then what else? A massage. Yeah, that's the most common thing that usually a patient came, and what they have done when I saw that the knee become worse or any part of the body become worse. If you can recall back what I've mentioned earlier about the 5 signs of inflammation, yeah. Okay, so the inflammation, you have warm, and then you have swelling, you have redness. Okay. When you have range of motion, what one more I forgot, there's a lupa pula. Okay, anyway, what caused the swelling? If there's let's say you knock something, yeah, inside, it may cause a bit of damage of the tissue, may some blood vessel breakdown, small blood vessel breakdown, or maybe some tissue tear. Yeah, when tissue tear, it will come out fluid. You have to remember, cells of the tissue, 50 to 60% is fluid. So when it tear, fluid will come out. So when the blood vessel tear, blood will come out lah. That's why sometimes when you see the swelling part, you see, or sometimes, oh, ada just swelling only. Sometimes you can see ada biru-biru bruises, something like that. So basically, there's the vessels break lah. So jadi darah, the blood keluar. Okay, so what to control that? You need to apply ice. So ice will constrict whichever tissue tear. If the blood vessel tear, then the blood vessel will shrink, then no more fluid come out from there, it will constrict. And also the tissue, when you apply the ice, then it will constrict. So then it will prevent further swelling. Okay, so when you have let's say after you apply the ice, so how many times? So most some patient will ask, how many times I should apply the ice? Okay, for first 72 hours. Okay, that's 72 hours. You give the point 70 hours. The first 24 hours, you need to apply ice as regular as possible. If you have to do what you call the every 2 hours, each 15 to 20 minutes. As much as possible, the ice do not touch your skin directly. You need to layer, yeah, because most of the time I've seen quite a number. Despite I explain to patient to cover with a thin layer or covered with something cloth or towel, they straight away apply it because they said that they cannot feel it or they will not cepat. So and then when they come back, so what happened to the skin? The skin, the patient will experience blister. So try to avoid direct contact. We don't know. Your of course, if you are your skin very tebal, then no problem lah. But some is quite sensitive, so you have to be careful on that. But yeah, apply with cover, and then you apply for about 15 to 20 minutes. So the first 24 hours, as much as frequent, yeah, 2 hourly, 3 hourly, and then the next 24 hours, the next day, you can make it a bit jarak, until 72 hours. If let's say after 72 hours it's not improving at all, so you need to go and seek further advice, yeah. Maybe maybe something happen bit serious that need to be tackled. But if you sure that within the injury you confirm that's a fracture, immediately lah, tak janganlah tunggu 7 days, ada 3 hari. Ada je yang dia tahu ada fracture, macam the toes fracture, dia simpan. Then the appointment come to see me, what happened when I saw the pain, ni mesti ada fracture. So send for the x-ray, yep. So I asked, why you have to wait to come, pergi jumpa lah doktor, sana you get immediate treatment, something like that. So because the thing is, kalau if the fracture is simple, it's okay, but what happen if the fracture is quite bad, and then it's damaging the surrounding tissue and so on. So you have to, if you are not sure, and then each time when you weight bearing after your injury, you feel pain is become worse, so might as well you seek treatment. If not sure at all, pergi je lah. It's no harm to seek treatment to get further what you call that, opinion. Yeah. Okay. Next. Okay. Next again. So seek treatment tadi as mentioned just now. Okay. Now you can see the difference. Yeah. This your picture on your right, the A and the picture B. Okay. So picture A, you can see that the person left leg is smaller, the quadricep muscle, the above muscle, above the knee. The right knee, the muscle above the right knee, you can see the structure of the quadriceps. You can see the vastus medialis, where the prominent on the medial side, the what we call vastus medialis, if you remember the muscle I mentioned earlier. So the structure of the muscle well developed and prominent, despite on the left everything is like macam dah tak ada dah, dah macam habis, bukan habis lah, shrink lah, totally shrink. This perhaps because of the knee pain, and then he's not being mobilizing, or I mean nobody advised, or he didn't seek advice what to do, how to treat the injury. So just leave it like that. Even if you leave it within 2 weeks, the muscle will shrink quite fast. Yeah, for an athlete I've seen, one athlete after 3 days, the muscle zoop very fast because of not doing anything, not doing even rehab at all. Yeah, because even though you have pain, there are movement that you can do without aggravating the pain. So yeah, it's not totally apa tu nama dia, rest. Nowadays we are not practicing total rest. Okay, so you need to modify and make sure that it's not aggravating, but you still stimulate other muscle to maintain the strength and then the mass. Okay, so same thing like picture B, you can see the difference between the right and the left. Okay, and then the knee structure is actually quite bad. Yeah. Okay, next. This is what we call muscle wasting lah. Same thing here. Okay, now you can see the right leg. See the hand where it pointed there. That is the vastus medialis. Yeah, vastus medialis or VMO is actually important structure of the quadricep. It will center your kneecap. Yeah, that's why when or you go for physio or somebody teach you, oh, need to do VMO exercise, meaning that to strengthen that part of the muscle to make sure that the kneecap centered. Otherwise, the other side of the muscle much stronger, so it will shifted. The kneecap not centered and shifted to the lateral, where the what we call the groove of the bone. Yeah. So when it over going up, then it will rub. That's where the clicking sound. And worst scenario, it will dislocate. Okay. Next. Okay, need just to show you the importance of exercise. So it's not just medication. Yeah, not necessary. Not to say not necessary to go for intervention, but sometimes you, even though if let's say need to go to operation, also you need to condition the muscles back. So I have a very good relationship with our DRJ team or arthroplasty team. Yeah, here. So if the arthroplasty team need times patient, because the the list, and somehow with the pandemic, the list is become extended further. So they will send to us and then encourage to precondition. So we precondition. I have few patients from the professors in arthroplasty that I look after. So we'll monitoring on this to make at least to maintain the muscle strength and muscle mass. Okay, next. Okay, again another example. Next again. Okay, so strengthening now. Next, so I want everybody, if possible, to follow. Yeah, if possible. Yeah, to follow. Yeah, even though I cannot see you. Okay. Yes. Okay. Okay, when you have knee pain, let's say you cannot bend, yeah, when you bend it's very painful, yeah. So you can do what we call isometric strengthening exercise. So you squeeze your muscle. How you squeeze your muscle? If you can see on your right, yeah, is it on your right? Yeah, on your left, yeah, on your left. Pictures, there are two pictures. There's two pictures of a person lying, lying flat. So you point in your toes, then the quadricep muscles will strengthen. That's where the red color appears, yeah, to show that the muscle contract. You can try that when you lying down, or you sit, yeah, sitting with straight your leg. But sometimes patients or individual not feel comfortable when they straighten the knee, they feel very pain, okay, because of the collapsing of the joint touching together. So what you can do, you put a towel underneath. So try to avoid, but when you try to contract the muscle, muscle, you won't feel the pain on the knee, but you can feel the muscle still contracting. But if you don't have any problem with it, you can still do the same thing without put anything underneath. Okay, next. Okay, this is the same. It's much clearer. I hope it's much clearer. That, like I said earlier, you can put a pillow, or you put a towel underneath your knee for those. So when you count 10 seconds. So I always ask patient. This is actually very simple and easy to do, either by lying down or sitting on the chair. Yeah. I told them, okay, try to do one set of 10 count. Okay, in the very beginning, try to do as much as you can. Let's say 2 in the morning, 3 in the morning, 3 in the afternoon, and then but towards the end of the day, you need to achieve at least 20 times a day, not at one time. Some they are too enthusiastic, they do at one shot 20 times, and then they start sakit-sakit. and then come back complain, oh, I cannot do lah, I feel pain. Why? How you perform it? Oh, I do it straight 20 times at one shot. I ask you to do 20 times at one shot? No, it's easier lah, susah lah, nak cari masa, something like that. You know, cannot. If you are not use your body, don't strain your body. We want to make your body improve, not to further straining the body and cause problems. Yeah. Okay, next. So when you repeat 20 times, meaning the whole day, pagi sikit, tengah hari sikit, malam sikit. Yeah. Okay. Next slide. Okay, so this is while sitting, yeah, but of course, sometimes it's not comfortable. If you want to squeeze, the other thing that you can do, okay, now I'm showing you, yeah, my demo. If you can follow, you follow. So I think this is just nice. You can see, hopefully. Okay, this is my left. Okay, you can do, if you have stool, hold on, I have stool or not? Contoh. Inilah. For example. Okay, so if you have stool, you can just put it there, down. Okay, if you can't straight your knee, it's okay, but if you can, it's better. So you point in, then you can feel your quads muscle tighten. Yeah. So then you hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then relax. Okay, now that another tips. If you can't count to 10, don't count to 10. If let's say after 5 count, you start to feel discomfort, stop. Meaning that your count, you only can do until 5 count. Then you can repeat again, rest for a while, and then do 1, 2, 3, 4, 5, and then stop. And then repeat again, 1, 2, 3, 4, 5. So this is modification. Even though the formula, so the prescription is 3 sets of 10, for example, maybe other person A can do 3 times 10, but person B maybe cannot 3 times 10. Maybe after 3, the start uncomfortable. So stop. Don't push. This is no time for no pain, no gain. Pain meaning pain. Okay, that's I always people literally translate as no pain, no gain, meaning that if tak ada sakit, maknanya bukan gain. No, meaning is you need to give an effort to be rajin and do consistently. Okay, that is no pain, no gain. Okay, so okay, this is an example. If you have higher stool or the chair, you can use the chair also. And then one more, you can extend. If you cannot do up higher, tak kisah, this high also can. And then you squeeze the point in, and then you count 1, 2. If you cannot until 10, that's okay. 1, 2, 3, 4, 5. Oh, I start to feel uncomfortable. You know what? If you do it regularly, yeah, rajin, every day, this thing you can do every day. Even you can do twice a day, morning and petang. 3 sets of 5, even 5 count, you do 3. Okay, nanti in the petang you buat lagi another 3, 5 count lagi. So buat. Of course, the end of the day, you need to target 20 sets of 10 second or 10 count. The counting is second, not 1, 2, 3, 4, 5, 6, 7, 8, 10. Yeah. Okay. Second, 100 to 200 to whatever, 1,000 or 100. Yeah. Okay. So okay. So if you cannot hold too long, that's okay. By time when it's become much stronger, you can feel, I can hold until 15, for example. So that is part of training. You need to train the muscles. You need to give the signal back to stimulate the muscle to strengthen and to become stronger. So if you just you have not done it before, and then immediately you force, yeah, when you force, that's where the pain aggravated, and then after a while you said, oh, the exercise caused me pain lah, I don't want to continue. And then when you see back the physio, or when you see us, the doctor, and they, oh, I cannot do that, each time I do exercise pain. How come when I do exercise pain? Because you didn't do it correctly, and if or you didn't modify, then you need to modify. Okay, you need to understand. You need to listen to your body. How much your body can do, even though let's say the physio prescribed 3 times 10 second. If you cannot do 3 times 10 seconds. Okay, now you have to think. Do I need to do it? Of course, you need to do it because otherwise the prescription is not being apa tu nama executed. So if not executed, by the time you go to see the your physio session and then the physio, did you do exercise? No. Even some patient when come to see me, you buat exercise tak? Dah. And then lepas tu complain sakit. Then I don't. You answer yourself lah. I ask you to do, you don't want to do, but you need to modify. Even I already mentioned you need to modify. I shown the modification, still tak buat juga. Okay, so it's your own body, it's your own problem. If you don't want to do, it's your problem. Despite we already advised. Okay, but again, what I want to trying to say is you have to listen to your body, but don't stop totally. You need to modify. There's a reason why they prescribe you the exercises. But if you cannot follow exactly, you need to, okay, I think my body says macam ni, I boleh buat. Even though only one set pun tak apa. But you consistently doing it, maybe I buat pagi satu, petang satu, or malam satu. And then you do it for 1 week. By time your body has start adapted and then it become much stronger. Oh, I can now do 2 sets. Oh, and then after 2 weeks, 3 weeks, I can do 3 sets. Okay, something like that. And then later on, you able to achieve 20 sets of 10 count. Okay, all right. So I hope that one understand. Okay, boleh tengok the next slide. What else I can demo? Maybe don't unshare first. Even they want to follow, they don't unshare because there's quite a bit of exercise demo there. I need to show. Okay, so while waiting for the slides, okay, so now, okay, the leg extension, yeah, okay, right. There's another exercise where I usually ask, where you need to lift. Okay, that is isometric just now. So when you extend, it's already a dynamic movement there. If you cannot bend and extend because you still have pain, you can raise without bending your knee, either while sitting or while lying. Better lying down lah, because it will support your back. If on the chair, make sure that you sit properly, support your back, or you put pillow behind your back. Okay. Another one is sit to stand. Okay, stand and sit. Also good, strengthen your quads and also your glutes. These two muscles are very important, for you to get up. Either get up from, for those that cross leg sitting on the floor, while praying, or maybe just want to sit cross leg on the floor, um, leisurely. So you need to have this, strong. When you have this muscle strong, it will hold the kneecap better and try to preserve the joint space better. Then you can then get up better. Okay, easy with no pain. If you still have pain, meaning that the muscle is still not strengthened yet. Okay, of course you need to get that kind of confirmation from whoever doctors or physio that you've seen lah. Okay, right. So sit to stand. If let's say this chair is too low, you can put cushion to make it slightly higher. Okay, so you can do exercise while sitting slightly higher. So make sure that the angle is more than 90 degrees. So easy for you to get up. This is a bit, nanti kemek kotak ni kan. Okay, just put ni lah. Make it just a bit of height. Okay, so make it higher. So easy for you to get up. Then you can do sit to stand. You don't have to do it fast, slow, up. Okay. If you have to hold your knees, tak apa. First time, nanti lama-lama bila you buat, you don't have to do it fast. Slowly pun tak apa, take your own sweet time. If you can do only 5, 3. Same. If you can do 3 sets of 10, that is your target twice a day, that will be very good. Of course, 20 is for the whole thing lah. Okay, so that's an example. So sit to stand. Okay, this one just now when you extend, you focusing on your quads, but also you put towel, towel on your foot, and then you slide in slowly. Or from the picture, you can see that the person wear socks, yeah. So you slide in. So when you slide in, you can feel that your hamstring contracting. Because when you strengthen your thigh muscle, it's not just quads, also your hamstring. Okay, and also side. That's what. Then just now there's a picture. You lie on your side, and then you lift up. Okay. So this is an easy exercise on the chair that you can do next. Oh, and the same thing. No, even masa kerja pun boleh buat. There's no such thing of I don't have time. Yeah, there's time. You didn't put an effort. That's all. Okay. There's always an excuses. Okay, next. This is the sit to stand. Okay, if let's say the chair is a bit too low, you can add on a cushion, one or two, to make it easier for you to perform the sit to stand exercise. Yeah. Okay, next. Okay, this is another way. You lean against the wall. Make sure when you lean, there's a gap distance from the heel to the wall quite far apart. So you don't bend, yeah? Because sometimes when people do this, the heel is too close, and then when the sliding down, it's bending the knee. That is not correct. It need to be, your knee should be behind your toes. If you can see the pictures, the knee still behind your toes. You don't have to go further down. You just stay and hold about, for example, here say 12 seconds. But if you cannot hold for 12 seconds, 5 seconds pun tak apa. Yeah. Okay, next. Okay, this is another example with the ball. If you want to roll up, you don't have to roll up. You just hold. Cukup. Okay, this is just an example for advanced. Okay, now I always receive comment, people, patient cakap, I buat squat tapi kenapa my lutut sakit? Because of this, when I ask them to demo, they bending the knee like that in the picture, which is actually not correct. So when you bend, you are pressing, the knee is being pressed, and ankle also pressed, less than 90 degree. That cause the pain. Okay, next. It should be drop, yeah. Drop your butt behind. If you cannot go too low, tak apa. Even, see, I can go down, I still can maintain my knee behind the toes. But if you can't, sikit pun tak apa. Even you cannot go down sampai 90 degree pun tak apa. Sikit pun tak apa. Make sure it's apart, about your shoulder level. Okay, stable. Then you go deep, deep. If some of you pernah follow my session, I always say, dip your butt behind and maintain your knee behind your toes. Okay, next. So see, even though full squat, still the knee maintained behind the toes. Okay, this is the correct technique when you squat down. So it won't cause any pain on it. But of course, for this person, he has very strong knee lah. So if you have a strong muscles, then it will hold the kneecap not pressing on the bone. So that's why you can able to go further down. Yeah. If not, sikit pun tak apa. Say, if you can go further down, go further down. If you cannot, just sikit pun is okay, as long as the technique is correct. Next. Okay, another example. See. Okay, next. Okay, resistance. I will show you sikit, and then after that, I think I have already taken so much time. Okay, so this, when you do this, we have resistance band. This is for quads. If you go to the gym, there's a leg press. So this is a leg press. Okay, leg press. So it will strengthen your quads muscle. Yep. So you, of course, if you want to do while sitting, make sure you support your back, or and then you put a pillow behind to make it more comfortable. Yeah. If you lie down on the floor, some is example by the picture. Next. Okay. As I said just now, muscle is not just for thigh muscle, for the knee to be stronger. It's not just one part of the muscle, one side. So you have 4 compartments: front, side, inner, and back. Yeah. So this is the quads, the hamstring. So the lateral, where the you need to do this, or for the inner, if you lie down like that, so the one that down on the floor, you lift up. Yeah. When you do this, make sure it tighten up closely. Yeah. Okay, so if you want to do while standing, make sure that you tighten up closely so you won't use so much effort. So it's easy. Yeah. Okay. So for example, if you want to do side muscle, this standing on one leg, side. Okay. So for the front, yeah, quads. Okay. So if you want to focus more on the hamstring, then that's why when you tighten up very close, yeah, buat rapat the resistance band tight to your both leg, so you don't have to give so much effort to push so much. Okay, and then for inner thigh, cross side. Okay, next. So same thing. Next. Yeah, I think that's all for this session. Sorry, taking so much time, more than 1 hour. Okay, I pass
Hi,
over
doctor.
to
Thank
Pavit.
you so much. So, shall we have the Zumba?
Movement. Okay, sure.
Right now.
Okay, hold on.
Max Pisolante, Piso Music,
Okay,
from the ghetto.
ready?
Oh,
Move.
yeah.
One,
I'm feeling sexy
two.
right now.
You
I
don't have to
wanna
move,
lose
just
control. Just take me
move your
to the
hand only
dance
can.
floor.
Hup.
I wanna dance with you, with you, with you, with you tonight.
Two to your
I
right, two
wanna
to your
lose
left.
control. Just take me to the dance floor.
Hold. One, two, and shake.
También me muero por
One,
bailar
two, and
contigo.
shake.
Otra noche tú y yo,
One,
acá
two,
arriba
and shake.
vámonos. Vamos a
One,
bailar
two, and
otra vez.
shake.
We gonna
And move.
dance,
And back.
we gonna dance
Wave, yeah,
forever,
wave. And back.
forever
Okay, move.
together.
And back.
We gonna dance
If you
forever,
want to move, can. Don't want to move, also can. Don't worry.
forever together.
Okay, butterfly. 1, 2, 3, 4, 5, 6, 7, change. Okay, side, out. 2, 3, 4, 5, 6, 7, move.
Te mueves como tú te mueves, métele hasta abajo, baby, que
2,
el calor que
scoop,
tiene
2,
no me
scoop.
entró. Dale con todo, lo tuyo es bien fast, nunca vaya
3,
too
pull.
slow.
1,
Sabe cómo
2,
me gusta la
3,
cosa,
4.
suena la
1,
música y te
2,
pone más
3,
sabrosa.
4.
Meneate,
1,
mami, eres la
2,
más
3, and
poderosa.
twist.
Ra, pa, pa, ra, pa, pa.
Again. 1,
Sabe cómo me
2,
gusta la
3,
cosa,
4.
suena mi música y te pone más sabrosa.
Okay.
Meneándote, mami, eres la más
Pull.
poderosa.
1, 2, 3. Okay, again. Lasso.
I'm feeling sexy
2
right
lasso each side.
now. I wanna lose control.
Okay.
Just take me to the
Nak
dance
move boleh, tak
floor.
nak tak apa ya.
I wanna dance with you, with
Hey.
you, with you, with you tonight. I
Again.
wanna lose control. Just take
2,
me to the dance
3. Pull.
floor.
1, 2, and shake.
También me muero por
Pull,
bailar
pull and
contigo.
shake.
Otra noche tú y yo,
Pull,
acá
pull
arriba
and
vamos
shake.
Vamos a bailar otra vez. We're
Move
gonna
forward.
dance.
Wave. And back. 1, 2, 3, 4. 1, 2, 3, 4. Again. 1, 2, 3, 4. One more time. Hook. And back. 5, 6, 7, 8. Okay. Butterfly. 5, 6, change. Okay, ready. Side. Side step. Okay. Hey. Hey. Okay. Good. 4. 1, 2, 3, 4. Okay. One more. Pull. Pull. 2 to 3. And 4. Again. Please. Again. 1, 2, 3, 4. Again. Please. Okay, wait. Move forward. And back. Again. 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 Back. One more. 1, 2, 3, 4. Okay. We have 3 more songs, yeah? The last one kita buat stretching. Okay, it's easy. I'm sure you familiar dengan lagu ni kan, lagu lama. Okay, 4 step. 1, 2, 3, 4. 1, 2, 3. 2 step ya, sorry. 4 count. Okay. Pull and step. Up. 2. Just point. Pull. Okay, ready. Down. 2, 2, 3, 4, 5, 6, 7, 8. Okay. 1, 2, 3, 4, 5, 6, 7, 8. Now. Again. Okay, okay. 1, 2, 3, 4. Lagi. 2 step tadi. 1. Lagi. Again. Again. And tap. Front. 1, 2. Again. Okay, dua tangan. Up. Pull. 1, 2, 3, 4, 5, 6, 7. Down. Again. 1, 2. Again, again. Okay, walk. 1, 2, 3, 4, 5, 6. Move back. 1, 2, 3, 4. Again, move forward. 1, 2, 3, 4. Side and side. Belakang. Yay! Now shake. Again. Okay. Again. Okay, hop. Change side. Depan lagi. One more. Okay, 5, 2. Ya, sampai habis. Okay. Okay, one more. Sebelum kita buat stretching ya. Right. Next song. Okay, next song. You have to gelik ya. Okay. Get ready. Okay. Single, single, double. Single, single, double. Okay. Hip. Now. Wait. 4, One, two, dua, tiga, and move. And shake, and two, dua, lagi. And shake. Okay, repeat. Stay. Okay. Hip. Hip. And move. And shake. One more time. And shake. Okay. 1 and 2 and 3 and 4. Dua tangan. Okay. Snake. Okay. Again. Hey. And stay. Okay. Cross. Heel cross. Cleopatra. Okay. And pull. Hop. Cleopatra lagi. Ho. 1, 2, double. One more time. Shake. Ho. One more time. Okay, move. 1 and 2 and shimmer. Okay. Okay. 1, 2, 3, 4. Dua tangan. Snake. Okay. Oh. Hey, snake. Shake and pull. Repeat yang tadi Cleopatra. Okay. Hip. Okay. If you can't follow exactly, just move your hands up. Now, hook. 1, 2, double. Lagi. 2 more. Okay, last. Okay. 2. Snake. 1, 2. Again. 2 tangan. And stick. Again. Alright. 2. Snake lagi. Okay, last one. Hip. Okay, ho. Muah. Okay, last stretching. Okay, relax. Okay, just relax You do stretching. Okay, ready. Now. 1, 2, 3 and 4. Dua tangan. Okay, slide slide. Okay, right leg, front, back, front, back, front, and back. One more time. Front and hold and stay and lean forward. Stretch your hamstring. Okay, down, down. 3, 2, 1 and touch your toes. Satu tangan angkat. Stay and 3, 2, 1. Okay, lift up and push. Stretch. Calf stretch Now, turn upper body side. Count. Okay, stay lagi. 3, 2, 1. Okay, and hamstring. Front hamstring stretch. 1, 2, 3, 4, 5, 6. Again. Okay, rapat. Stay and inhale. Exhale. One more time. Exhale. Okay, hold. Same thing kaki kiri. 3, 2, 1. Now, 1, 2, slowly. 3, 4, 5, 6. Okay, 7 and stay, stay, stay. And lean forward. Stretch. 2, 3, 4, 5, 6, 7. Okay, now reach and up. 2, 3, 4, 5, 3. Okay, lift up and stretch your calf. Lagi. Okay, and turn your upper body saja. 3, 2, 1, and pull down. And 3, 2, rapat. Okay, reach out. Reach out. Reach out. Your leg fix, waist and above only move. Okay, lagi. Push and stay. And 1, 2, 3, 4, 5, 6, 7. Okay, reach down, stretch. Stay. And 3, 2, 1. Up. Okay, other side. Down. 1, 2, 3. Down. Stretch. Okay. Stay. Okay, and front slowly. 1, 2, 3, 4. Okay, rapat. And stretch your hands. Okay. And stretch. 3, 2, 1. Switch. Lagi. Okay. Up and push your elbow behind. Okay. Now change. 1, 2, 3, 4, 5, 6, 7. Okay. Pull your hip. Tahan. Okay, and then your chin hold. Alright, and then stretch. And change. Last. Okay, inhale. Exhale, inhale. Exhale again, inhale. Okay, last one. Inhale, deep inhale. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Hey! Okay, well done, everyone. Good job. Good job.
Thank you, Prof. Nahar, for this wonderful session over the weekend.
Okay, though with knee replacement or inserted the metal and still have knee pain, can follow this exercise that we did today?
Can. I have one patient, male, very rare to have male done TKR. He's at age of 60, early 60s, but the TKR done when he was 50s, in his 50s. Of course, he did his total knee replacement at private hospital, but it turned out he's good. But the problem is when he came to see me, other than his neck pain, neck problem, he also complained of the knee, not to say knee pain, but he felt discomfort. But despite he already done knee replacement, when I assessed him, I found that the muscles is actually not sufficiently strong enough. You know, there's a wasting. And when, because the other thing that when patient come to see us in our clinic, we will do a body impedance analysis where we will check the muscle mass, fat mass, of course the weight, but usually I won't see the weight. My main will be the muscle mass, the percentage body mass, and then the segmental. because we can identify which part, not exactly which muscles, but whether it's right hand, left hand, I mean limb, not hand, the right limb, left limb, right leg or left leg. So, but in general, his muscle mass is very low. So we call it for everybody over 60s when low muscle mass is sarcopenia. Usually it's very difficult, but he's actually very, very, what do you call, motivated. So I, I teach him few simple one. So he comply, which I can saw improvement within actually the next visit. I didn't see him very frequent, about 4 to 5 months once, because he don't have any such problem. And he also okay, he can manage himself very well, and he said just teach him and he will do it. So he's very, very, so I teach him exactly, at the very beginning. Same exercises that I explained to everyone just now, same, nothing less. Okay, so he comply. Even I teach with resistant band, and he did the lean against the wall. He did 20 total of 25 in the morning, and today I have, you do okay. As long as it didn't aggravated his problem, that's fine. So basically, he's improved. So when he came for the visit, the following visit, the muscle mass which was under which not normal, it became normal, and then he achieved his ideal weight with ideal fat mass, which is for me for 60s who able to achieve that is very, very, very good lah. You know, very rare for someone. Of course, he's male lah, and then he's very, you know, he can do strength, but he didn't go to gym much anyway. He do it by himself. So whichever exercises that I thought I showed him, he will follow diligently. Religiously, not religiously, he will follow. So he will ask more each time when he come to see me. So to answer your question, yes, although the explanation is terlalu panjang.
Okay, thanks. Next question. When I have my bend my right knee, there's a pop sound coming out every time. So should I be concerned and seek for treatment?
Again, can you repeat again?
When she bend her right knee, that there is a pop sound coming out every time. I think it's like
Each
a
time,
cracking
is
sound.
it each time when he bend the knee?
Yeah, bend the knee. Yeah.
Okay. Is
Should
there
I?
any,
Yeah.
did she mention any swelling? If Rachel can, if you listen to me, okay, answer my question.
No, no
I
swelling, Prof.
answer, you
Nahar.
need to answer my question before I answer your question. Whether there's a pain, whether there's a swelling, each, pain basically. Of course, you may have that pop or clicking sound, but is there any pain or swelling
No,
after
no,
that?
there's no pain or swelling. Just that the sound is very loud every time. So,
Okay. Okay. If you remember that when I mentioned about this, where when your VMO muscle is weakened, yeah, you know which the VMO vastus medialis muscle, isn't it? Just now I showed you the one that inner thigh, yeah, but not the adductor, the inner part, yeah, because the quadricep you have 3 component visible, one more component behind. So the one that we call VMO is weakened. So when it's weakened, your kneecap will shift to lateral. Yeah, instead of supposed to be here, supposed to be in between. Yeah, here, because there's a knee groove along your end of your thigh bone. So when your VMO is not strong, this part is stronger, so the kneecap will shift. When it shifts, so it will rub the ridge of the end of the groove on this side. So you are the groove knee, so you are the 2 edges. So the kneecap will fix dekat sini. So when you bend and extend, it will cluck, 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 cluck. If you muscle is later, if not doing anything, it may dislocate it. especially when there's a force, like you fall or apa, it can dislocate it. I've seen quite a number. Some of the nursing teacher, I've told her, you need to exercise, and one day it happened, and then she malu dengan saya when jumpa saya because you have told me, but I didn't follow. So anyway, but that's done, so she has been operated. So what you need to do, the strengthening exercise lah. If you're not sure, then you need to see physio, or you can see any sports doctor or rehab doctor. Okay. If your GP knows, then he will teach lah. I doubt some of the GP knows lah. Okay. Now I'm not underestimate, but I doubt, that's all. Yeah, if they go for some courses, understand about strengthening exercises, they should know lah. Okay.
Okay,
I hope
thank
I
you.
answered the question. Yeah.
Thank you, Prof.
Yep.
Okay. Next question. Yeah, she was experiencing knee pain on the right when she bent her knee. So she does the power walk exercise 5 times a week. Sorry. Then
Uh,
noticed slightly swelling at the knee. Yeah,
oh,
went for physio and also did some exercise and have been doing, but the swelling has not completed disappear. Is that all right or life threatening?
it's not life threatening. You need to be further investigate. You need to see the doctor again. But if the same doctor didn't give you satisfying answer, you need to get second opinion. But of course, don't agree to any operation yet until it's really warranted. But I expected that it maybe it's still inflamed lah. Because if there's swelling and warm, just remember the 5 signs that I mentioned just now, and some more. You still do a power walk despite that, or you have apa to ease down or not doing anything.
Okay.
Uh,
She asked, sometimes her shoulder joint makes sound with every move.
yeah.
Why?
Okay.
Is this bad or dangerous?
No, it's not dangerous, but again, it's coming back to the strengthening of the muscles lah, yeah. Because
Mm.
as I said, I'm not sure your age. I'm not sure whether you have any episodes of pain before or injury before. But despite that, if no, let's say you have very mild discomfort last time, your body will try to avoid any movement to any parts of the body, as I mentioned earlier. So when the body rests to avoid extra or the normal, supposed normal strength that the shoulder should do, and then you do, I mean, basically the activity become much less. They will be so-called wasting muscles lah. The muscle will start weaken slowly. So when the muscle become weaken slowly, especially at the shoulder joint, so the muscle unable to preserve the joint space. Yeah. So when it's unable to preserve the joint space, once you move, so it will click. Yeah, either here your clavicle towards the end, or the joint of the humerus also will rubbing the bone or something like that. So yeah, it's actually because of the strengthening part. Yeah, if despite the strengthening of the muscles not really resolved, then need to seek further lah. But it is not life threatening lah. It's just need to be investigated what caused it. But I'm sure is basically need to do some strengthening. But if you want to get perfect answer, not to say perfect like exact answer, may need to do further investigation. It may again, it's not really worrying or something life threatening, but something need to work out on it. So yeah. Then
Okay.
if you do the exercise of the shoulder, for example, don't do um, start gradual, yeah. Whatever it is, start gradual. Maybe we can have another session later. I'm not sure. We talk about back or talk about shoulder next time, because today we talk about knee, can. Okay.
Okay. Next from Sugan, is Zumba and aerobic dance recommended for ladies over 65 years old?
I don't see any problems, but only you need to modify. I always, even if you know, the ESG team members who come when on Saturday, not during the pandemic, but not during lockdown. Sorry, when they come, most of them are more than 60, more than 60. Yeah, whether they're 65 or not, that I'm not sure lah. But most of them are more than 60s. Okay, but I always told them, try follow your own pace. Eh? So it's about pacing yourself and do as much as you can. Listen to your body. Just enjoy yourself. Just move. Okay? Because I'm sure if you are used to aerobic exercise, you want to do something else. It's not very motivating for some, yeah, not all. So they still need that music and movement to enjoy the exercise. So for me, you just need to modify. Modify meaning you low down a bit the intensity. If the pace slightly faster, you just pace yourself. Don't follow exactly. Don't worry, there's no wrong or right in movement. Yeah, you just need to enjoy and move and make sure that your movement is safe. And then you also, in terms of you have checked your senior, your doctor say that okay, you can do exercise. Okay, even when we prescribe exercises for those over 60, we always recommend to follow their own own will within their limits. Yeah, and then don't exaggerate. I have 172 male male. He is very, I would say, kiasu lah, very kiasu. Each time he's very concerned. Oh, I didn't do this. I don't do enough this. I really pening dengan orang macam ni, but I layan lah. But in the end of the day, after a lot of pep talk and advice, so he listen and follow, and then now he actually in a very good shape. You know, he's features like an athlete, even though he's 72, but he's very fit person for 72 years old. Even looking at his fat mass, his percentage body fat, it's like an athlete. Okay, so basically, what I'm trying to say is you just need to modify, listen to your body, yeah, move accordingly, and safe. Make sure that you don't injure yourself. That's all.
Okay. And JT hips feel a bit sore after sitting more than 30 minutes, slowly sore when go away after walking. So what exercise can help her?
Again.
Yeah,
I
her
didn't hear that.
hips feel a bit
Song.
sore after sitting more than 30 minutes.
Oh,
Slowly sore, go away after walking few minutes or so. So what kind of exercise can help her?
okay, of course, this need to teach back, lower back, and hip exercise lah. No need to demo lah. Okay, but
Okay.
in a way, if you have discomfort and when you feel you touch over the hip area, especially after prolonged inactivity, prolonged inactivity. In your case, 30 minutes already cost you some discomfort, and you touch at that place, let's say your right hip or left hip, and you feel warm, you already have pain, but if you feel warm at the same time, then you need to apply ice lah, to reduce the inflammation, meaning that there's inflammation because of, you know what, you are right, the muscle strength is maybe not sufficient. That's where when you sit, it will pressing each other. So when you move while you're sitting, it may cause inflammation lah. Of course, you need to do hip exercise. This simple. I just show you simple, but you need to adjust. But there's actually other exercises. You can if you remember just now when I show with the resistant band. So just start without resistant band. So your hip movement while standing, or you can do while sitting or lying, no, while lying down, not sitting, while lying down, okay? Better stay while lying down. So when you lie down, you lift up, okay? Back, and then side, okay? Of course, when you lift forward also, you are strengthening your hip, yeah? Don't add any resistance yet, and then don't make it too high, okay? So you repetition is up how much you can do, and sets. Let's say one sets of 3, you can do 2 or 3 times, okay? And then some more you can do the, you know, when you do stretching your back, you flex your hips, you can add on also that, okay? Do that, but there's a bit of extra other stuff also need to teach, because it's not just the hip, but also your lower back need to be strengthened at the same time. Then you need a core lah, basically. So you need to have a core strengthening exercise at the same time. I think maybe that one next section lah.
Does magnesium oil help to relieve joint pain?
Okay. Sorry to say, I have no experience. I cannot say any comment on that. I don't want to give any wrong information. Yeah. So okay. The important thing is, if let's say this is basic, yeah, any joint pain or any muscle pain or any soreness, you need to touch your part that you feel discomfort or tightness. If you feel pain, yeah, pain, and then you feel warmth, and then when you press a bit macam ada bengkak sikit, yeah, and then when you move, it become painful because of that swelling. The important thing is when you pegang is warm. So when you feel warm, warm meaning that compared to the surrounding skin, yeah, suddenly you touch your hip or your knee, this is warm. But when you touch other part, you feel, kenapa sini panas? Also meaning it's inflamed lah. So when there's inflammation, I would recommend you apply ice. But if you feel it's a bit cooler, sometimes you feel a bit cooler, kenapa ni sejuk kat sini tak? Okay, then and then you feel a bit tight, then you use hot pack. Or even if you have hot ointment, if let's say your oil, magnesium oil, you can, is it magnesium? Yeah, you feel can feel warm and feel okay with it, why not? Yeah, I don't have any objection on that. So because I'm not familiar, that's why I don't want to give further comment. I may give wrong comment. Yeah, but the principle is that if you find that that magnesium oil helps, yeah, when you have stiff joint, yeah, but not inflammation, yeah, stiff joint. So by all means, you can continue. All right.
Okay, so if I have knee pain, can still do hiking and skipping? Will the knee guard help?
All right. Okay. Now that's a very interesting question. Okay, I cannot stop people who are inactive. If you see other doctors, yeah, non-sports doctor, they will say no, you cannot. Okay. For me, I will say okay, but you need to adjust. You need to cut down your intensity. If let's say you find that you when you climb is aggravating, why you want to aggravate yourself? You just do level walking je lah. So you don't stop. Maybe you stop hiking, but hiking in a level on a level ground, at least you can still exercise. Okay. At the same time, you continue your strengthening. So because from my observation, those who do one type of exercise, they only do one type of exercise. They never do strengthening exercise. I've seen quite a number, yeah. So when I told them you need to do strengthening exercise, oh hiking tak cukup No, hiking is hiking. Of course you are the lifting, but it's not strengthening. Yeah, strengthening you need to give time and effort for strengthening what I have shown just now. Okay, when you use the knee guard, for acute pain, when you have very acute pain, I may give a little bit of okay lah, but even though personally I'm not encouraged, you know why? When you pakai knee guard, okay, you pakai knee guard, you are replacing you are resting your muscle. Your knee guard will become your muscle. Okay, but if you use knee guard and then later balik rumah you buka and then you do the strengthening exercise, that's okay for me because you want to keep active, that's fine. But don't forget to do the strengthening exercise and start to wean off when you feel comfort when it's improved. Otherwise, when you use for long term, your muscle will become shrink. I've seen orang pakai knee guard, kaki yang dia pakai knee guard tu kecil daripada kaki yang satu lagi. Okay, so I think that's my answer lah.
Okay.
You can still exercise but you need to modify. That's all.
Okay.
You can use the knee guard provided you janji you bought the strengthening exercise. Okay.
Yeah. I did not exercise for 2 weeks when I have the swelling, but the physiotherapy say I
The
have to
what
continue swelling.
swelling off
After I did not exercise for 2 weeks when I had the swelling.
swelling off.
I think it's the knee. Yeah,
Okay.
yeah. She didn't mention which part of the
Oh,
body. Yeah, but the
yeah.
physiotherapy say I have to continue exercise. Yeah. So will the swelling will go away?
Okay. That's why I want to know what swelling is that. Which part? Maybe what the physio meant by continue the exercises, strengthening exercises that the physio wanted the patient, the I mean I mean whoever the answer asked the question to continue. You remember when I mentioned that if you still have pain, you still need to continue your strengthening exercise. Yeah, exercise doesn't mean you have to walk, you jog, or you cycle. Yeah, but strengthening also exercise. So when you talk about exercise, it's not just cardio, also strengthening, also flexibility or stretching or balance. These are all exercises. Okay. So usually when the physio mention about the exercises, it's about the strengthening exercises that he or she asks the patient to do at home lah. That's what from my understanding what the physio maybe tell the person to do. When you strengthen the exercise, because when your muscles not strengthened enough, so when you start walking, the inflammation is still continue. I'm referring to the knee lah. You stand, there's a pressure. And then when you move a bit, then there's a grind between the bone. Okay. But when you start continue the strengthening exercise, the muscle will become stronger. So we will try to preserve the space. So when you stand, it will will less loading to the joint, and then for by time it will improve and become much stronger. It will take maybe between 4 to 6 weeks, but you have to be rajin lah. But if you stop sekejap buat sekejap tak buat, and then it will be there even the next visit when you see the physio or the doctor pun dia cakap I buat exercise tapi selalu when usually I will ask, do you do it regularly every day? You cannot tipu saya because I know if you do it or not doing it. Yeah, some of you who is my patient, they know how very detailed I will check. So if you tak buat, I know memang you tak buat. I know you tak buat. If you buat, I know when you buat. Okay.
I am 57 years old and have osteoarthritis in both knee and PID from L3 to L5 to S1 in my spine. So my left knee is much worse than the right. Okay, my left thigh muscle are much weaker now. So should I continue with the exercise that you showed us just now with strengthening the quadriceps? Am I able to walk for exercise? Should I continue with swimming? My arthropedist and physiotherapist also told me to swim. It seems that I should avoid weight bearing exercise.
Yes. Yes, if you have, mostly, okay. Right. When you have knee pain, even I will encourage my patient to do no-weight bearing exercise. If you still have pain also, when you do no-weight bearing exercise, especially inside the pool, it is actually, you feel very relief. I've just not I fortunate. I have one patient fortunate. The whole family, the sister ada rumah, ada swimming pool, and the little sister, but not little lah, already 50 something, and the older sister who have same problem. The whole family semua datang jumpa, and then I told them you need to exercise inside the pool. So they did, and then when they did the exercises, it shows improvement. At one time, they pain free. Yeah. So all the movement, what the physio have taught you, even though you have back pain, but actually, I would encourage when you have back pain like PID, do exercise inside the pool, because of the water will give you buoyancy, to float, make you floating as if that you walk on the air, on the moon, on the moon. You do movement inside the pool. I have one patient actually. She initiative before the lockdown lah, went to swimming to find a pool and then have some instructor to teach her, or if not pun dia akan buat all these exercises that I've taught, do it inside the pool, and she felt very comfortable when doing all the exercises inside the pool because you feel secure, like you being hugged when you are inside. When I inside the pool also I will do the same thing. Then meaning that when you inside the pool doesn't mean you have to swim. You exercise, do all the exercise, just walk inside the pool. You will feel floating. Yeah, no, there's not much weight bearing on your ankle and even on your knee or on your back. So you feel you can walk straight. I have one rheumatoid arthritis patient where have crooked, and then she need to use crutches when come to see me once in 4 months. She's a rheumatoid arthritis patient under rheumatoid clinic, but she came for me for the exercise when I gave one talk to the rheumatology society. So she approached, she want to get, even though she cannot achieve 100%, but when I asked, I started with so-called apa tu, aqua exercise, hydrotherapy. Yeah, hydrotherapy. She felt very, very comfortable, and she felt more confident. So I think to do exercise in the pool doesn't mean you have to do swimming. You just walk inside the pool slowly, you take your time, you take from one end to another, you repeat like few minutes, and you just swing inside the pool. Jangan swing kuat-kuat sangat, but simple, because when you swing, the resistance from the water will give you the resistance. The water will give you the resistance. So there's already resistance training inside the water. Even when you stand, let's say until up to the chin level, you move, you are strengthening your upper body at the same time, but at the same time, the water will maintain your posture in the right alignment. Okay, I hope I answered the question, ya. Banyak sangat.
Okay, thank
Cerita
you,
lain
Prof.
lagi.
Chef asked that how many hours should we exercise per day? Is there such thing as over exercise, meaning if you do exercise for, let's say, 3 hours continuously?
Okay. Before I can answer the question, you need to understand the intensity. Of course, when you talk about exercise, you need to know frequency, how many times a week, and what exercises you can do every day, what exercises you cannot do every day, how much intensity that you need to do within each time when you do the exercise, whether you do low intensity, whether you do moderate intensity, when you do high intensity. Of course, when talk about recommendation by even WHO in regards recently in last year, they came out with a guideline for physical activity and sedentary behavior guideline. So one of the important for those yang never exercise, a bit of movement is better than nothing at all. But for those yang already active, actually, if you do within moderate, what I meant by moderate intensity is if you don't have any gadget to monitor your heart rate, you just simply, let's say when you walk, even though you puff, you can still communicate with your whoever peers with you, partners with you. Even you puff, I know you are puffing, but then you still can communicate, even the partner can understand what you are talking about, so that's moderate intensity. But if low intensity, meaning that you are singing, you are gossiping, and you are laughing all the way, that's a low intensity lah. Okay, and then high intensity, basically very exhaustive. Even you cannot talk at all while you doing exercise. So that's the simplest guide for you when to look at intensity. Now coming to the question, how much is how much, and whether how apa tu nama dia, how over the such thing or overdoing it, over exercising. Yeah. Okay. Recommendation says 150 minutes per week to 300 minutes per week for moderate intensity. Okay. For high intensity is 75 minutes, 250 minutes per week. But that for everyday people. But for those who yang dah ever fit, yeah, maybe like myself or maybe like some yang dah, you know, it's already part of their life, and then tak pernah miss pun ya. Okay, so you can go beyond 300 to 450 minutes per week. So you divide lah tu. But for those yang tak biasa, the moderate, I'm talking about moderate. But for low intensity, actually you can give a bit extra, okay, per week. Maybe an extra of another 30 minutes instead of 130. You can go to 200 to maybe to 300. Okay, 300 to 600 per week for low intensity. Yeah, since you have that time, like when you do walking. Yeah, when you do walking. Okay, again, it depends on your body adaptation. Okay, of course, when you push, let's say for example, let's say you run marathon on Sunday, you completed the marathon about 4 hours, is considered fast lah. For 5 or 6 doesn't matter, slow pun, but you still need effort, or even you spend sampai 7-8 jam pun still you spend, that is your effort, but it's actually very stressful. So you don't lah the next day you what do you call that, do heavy exercise. You just rest totally. Can you do maybe jump into the pool and just relax je, or just do something light. That's all to recovery. You can recover 1 day or 2 days, depends on the activity level on what you did previously. Okay. Okay. Now, there's the call, what we call overreaching, overtraining. Yeah. That if let's say you do the same intensity, let's say high intensity continuously for 1 week, I've seen this a lot in athletes, yeah, and then suddenly the coach push them and train hard. Usually their training session maybe about 1 hour and then not too much. So every day 1 hour. Suddenly because of the competition, the athlete need to participate next 2 weeks. So it's not enough time to gradual. So the coach push, yeah, push. Instead of training 1 hour, every day 4 hours. Okay, that is over training. Yes, there's a such thing called over exercise lah. For that is over exercise. Okay, if that's the case. But if you gradual increase, your body already adapt to it, and then no side effects out of that your activity. I have one neighbor. I didn't know him very well. I watch him every day. He walked 2 hours, and then he lost his weight. He's very tall. He's taller than me. He's 6 footer, but because of the height and then the weight is considered big lah, macam bear, Papa bear macam tu kan. Tapi after 1 year, even though still nampak dia masih ada ini lagi, tapi shrink, you know, from this to this. So what he did, he just walking je. Walking every day, every night, tiap-tiap hari. Night 8 o'clock nanti I dengar dia kalau, because I'm staying in condo, so in between we have swimming pool, a big swimming pool, and then a park, macam a small park around. So we have 3 blocks, and then in between is the park. So it's very secluded, very secluded. Orang tak boleh masuk kita punya condo area, very exclusive. So jadi dia jalan, and then night I will hear he's talking, chit-chatting lah sambil he's walking. So that's okay. Okay, so you just need to see whether that is already part of your routine, and then it's not aggravating your problems, your pain or whatever. But if it's so aggravated, then you have to cut down. And then maybe the next day you need to do something light. Okay, I think that's my answer.
Okay, there's no more any questions in the chat box.
Uh,
So looks like we have come to an end of the session. And thank you so much, Prof, for giving us your time. And let's thank Prof. Nahar for the session.
Thank you,
Thank you,
Prof.
Thank you,
Yeah,
Prof.
let's clap for Prof. Nahar.
Thank you. It was a very good session. Thank you.
Prof. Nahar.
Thank you,
Thank you
Prof.
so much.
Nahar. It was a very good,
Thank you.
entertaining